Hello and welcome to this short video looking at venous sampling. The purpose of this video is not to teach you how to undertake a blood sample. It's for those people who are novices, who are just starting out, to give them an insight into what it is like. And it's for the experts who need a little update because they haven't done the procedure in a while. The bloodletting system is a versatile system. There is a variety of tubes, many different colours, but they are simple to use, and we will run through that now. The blue tube is generally used for transfusion type procedures, and it has transfusion written on the tube. The red tube is generally a hematology type procedures, things like full blood count. The gold top brown coloured tube is a biochemistry type tube in general, used for biochemistry procedures such as liver function tests and urea and electrolytes. Finally, in this set of tubes there is a green tube. This is for coagulation type studies, and the important thing about this tube, it has to be a full tube, it has to be filled to the line. We have two systems with regards to accessing patients' veins for venipuncture. The most common system is a needle, which we will show you in a short while, being inserted into the patient's arm. And the other system is a butterfly system. Both systems connect to the bloodletting system in the same fashion. The blood tubes need to have the vacuum created. This is achieved by pulling the plunger back until the system clicks. At this point, there is a vacuum in this tube and you can dispose of the stick. The system is a push-on system, but it involves a twist. Once you've inserted the needle into the patient's vein, you can then attach the blood tube, like so. Once it is attached, it needs a slight turn, and that will lock the blood tube into place. If this needle was in a vein now, that tube would be filling with blood. It is important, once the sample has been obtained, that you twist and disconnect the tube. Disconnecting the tube prevents any blood leakage from the tube when you remove the needle from the patient's skin. When you are taking multiple samples, it is important to get the order of draw correct to prevent contamination. The first samples you need to take in a sequence of multiple samples is the coagulation and the biochemistry samples. The last samples you take in a multiple sample sequence is the transfusion and the hematology samples. Right, we apply the tourniquet, putting 2 fingers underneath so we do not nip the skin. We palpate the vessel, ensuring it has not got a pulse. We clean the skin in multiple directions for 30 seconds. We allow the solution to dry. As it's drying, we put on our gloves. Skin tension is important at this stage. Skin tension in multiple directions. Ensure the bevel of the needle is uppermost, with the yellow protective sleeve pointing out to the right hand side. The angle of insertion should be approximately 10 to 30 degrees, depending on the depth of the vein. And sharp scratch. You can remove the skin tension at this stage, but hold the needle in one place. Attach the vacuum tube. Allow it to fill. Once it's filled to the desired amount, undo the connection. Mix the tube approximately 6 times. Release the tourniquet, remove the needle, activate the safety device against the side of the tray. Once you've activated the safety device, dispose of the shielded needle in the sharps container, and remember to complete the label fully. Thank you for your interest in this short video. If you require any further information, please contact the Vascular Access team.